Peripheral edema. Patients with history of various health problems could present with edema. Check if the patient's edema is localized to body parts, such as face, any one arm, or lower extremities, or is it generalized to entire body. When assessing for edema and the extent of limb involvement, always do it by uncovering the limb to the extent possible. Seek caregiver assistance for the task, as needed. While assessing for pedal edema, make sure you remove the patient's shoes and socks. Also, note for any active risk for skin integrity on the limb involved, secondary to excessive fluid backup, and document it accordingly. Determine if the edema is pitting or non-pitting by applying pressure on the affected area. Grade the edema appropriately, according to edema grading scale, depth of indentation on application of pressure, and rebound time after releasing the pressure. Pitting edema could be secondary to cardiac issues such as heart failure, cardiomyopathy, and poorly managed arrhythmia. Circulatory issues such as blocked veins in the extremities, venous insufficiency or varicose veins, and deep vein thrombosis. Renal issues such as chronic kidney disease and renal failure. Other factors such as liver failure, malnutrition, and low protein levels in the blood can also contribute significantly to pitting edema. Non-pitting edema could be secondary to severe obstruction to lymph flow due to a cancerous growth, resulting in heavy backing up of lymph in the limb. Compromised mobility and sedentary lifestyle contributing to poor lymph drainage and heavy backup of lymph in the limb, such as in patients with history of stroke. Individuals undergoing removal of lymph nodes and draining lymph vessels, secondary to some underlying cause like cancer. Edema with swelling of skin and underlying tissues in individuals with hypothyroidism, typically referred to as myxedema. Determine the type of edema your patient has, and the possible contributory factors based on the history and physical received, and your assessment of the patient. For individuals with pitting edema, incorporate appropriate relieving measures on your plan of care, such as compliance with heart-healthy diet, controlling sodium intake, resting with affected limb elevated above the heart level, compliance with intake of diuretics as recommended, and compliance with fluid intake limitations as recommended. For individuals with non-pitting edema, incorporate appropriate relieving measures on your plan of care, such as therapy referral for physical exercise to the affected limb, encouraging compliance with home exercise plan established by the therapist, resting with affected limb elevated above the heart level, wearing compression garments and application of wraps to contain the swelling, and application of sequential compression devices to help move the fluid up the limb. Gentle massage to the affected limb also helps to stimulate open up the lymph vessels and move fluid along. Documentation for the weekly visit notes. Follow up on the degree of edema without fail. Add a comment on weekly visits as to how the edema has been doing since the last home health visit, as reported by patient or caregiver during all weekly visits. Instruct the patient or caregiver on grading the edema, maintaining a regular weight log as allowed, and keeping track of circumference of the limb involved, which all are standard practices for tracking edema. Encourage patient compliance with the instructions provided during weekly visits. Unresolving edema or progressively worsening edema could indicate deteriorating underlying health conditions. An easy measure could be taking a weight reading on the patient every visit, as applicable. Any 2 pounds increase in weight between 2 consecutive days or 5 pounds increase in weight over a week could signify significant fluid backup, worsening of edema status, and deserves to be reported. Check with your agency policy on the same. Report the finding appropriately to the physician for needed intervention and appropriate recommendation on medication or dose changes. Documentation for the follow-up assessments. During all the follow-up assessments include notes regarding if the edema has been stable or improved or deteriorated, and overall performance over the episode. Effective edema variation on the general health and overall patient performance. This could include details such as acute weight changes and improvement or worsening of shortness of breath and endurance status. Management measures in place and patient compliance with the same. Any instances of acute weight gain, suggestive of increasing fluid backup. Any instances of reporting to the physician and interventions suggested. Any medication or dose changes made over the episode towards improving the fluid backup.